Imagine peering into the human body with unprecedented detail, witnessing the intricate dance of organs, tissues, and even cells. This is not a scene from a science fiction movie, but a reality made possible by modern medical imaging. This is the power of magnetic resonance imaging, or MRI, a revolutionary technology that has transformed the landscape of modern medicine. It allows doctors to see inside the human body without making a single incision. Unlike traditional X-rays, which primarily reveal the skeletal framework, MRI allows us to visualize soft tissues with remarkable clarity. This means we can see muscles, tendons, and even the intricate network of blood vessels. From the pulsing grey matter of the brain to the delicate cartilage of our joints, MRI provides a window into the inner workings of our biological universe. It captures the complexity and beauty of our anatomy in ways never before possible. The implications of this technology are profound. It has revolutionized the way we diagnose and treat medical conditions, offering insights that were once beyond our reach. MRI empowers physicians to diagnose diseases in their earliest stages, monitor the effectiveness of treatments, and even guide surgical procedures with pinpoint accuracy. This precision can make the difference between life and death. It has become an indispensable tool in neurology, orthopedics, cardiology, and oncology, among other medical specialties. Each field leverages MRI technology to push the boundaries of what is medically possible. But how does this marvel of modern science actually work? What is the science behind this incredible technology? To understand the magic of MRI, we must embark on a journey into the realm of atoms and magnetic fields. It is here, in the invisible world of subatomic particles, that the true power of MRI is revealed. At the heart of every MRI machine lies a powerful magnet, a marvel of modern technology that has revolutionized medical imaging. This magnet generates a magnetic field far stronger than that of our planet, creating an environment where the invisible forces of magnetism can be harnessed for medical purposes. A force so strong it can influence the very building blocks of our body's atoms, altering their behavior in ways that allow us to peer inside the human body without making a single incision. While we often think of atoms as solid, indivisible entities, they are in fact composed of even smaller particles constantly in motion, each playing a crucial role in the fabric of matter. Among these particles are protons, which possess a fundamental property known as spin, a quantum mechanical property that makes them behave like tiny magnets. Imagine these protons as tiny spinning tops, each with their own magnetic field constantly interacting with their surroundings. Under normal circumstances, these fields are randomly oriented, creating a chaotic magnetic environment at the atomic level. However, when subjected to the intense magnetic field of an MRI machine, a remarkable transformation occurs, bringing order to this chaos. The protons align themselves with the external field, much like compass needles orienting themselves with Earth's magnetic field, creating a uniform magnetic environment. This alignment is the foundation upon which the entire MRI process is built, enabling us to capture detailed images of the human body's internal structures with unparalleled clarity. The human body is primarily composed of water, and water molecules contain an abundance of hydrogen atoms. Each hydrogen atom possesses a single proton, making these protons the most abundant and readily detectable particles in the body. As the patient lies within the MRI machine's powerful magnetic field, billions upon billions of hydrogen protons within their body align themselves accordingly. This alignment, however, is not absolute. The protons are not static, but rather wobble slightly in their alignment, much like a spinning top that is slightly off balance. This wobble, known as precession, occurs at a specific frequency that varies depending on the strength of the magnetic field. It is this precession that holds the key to unlocking the secrets hidden within our bodies. Once the protons are aligned, the MRI machine emits a series of precisely tuned radio waves. These waves, similar to those used in radio and television broadcasting, carry a specific amount of energy that matches the precessional frequency of the targeted protons. When the radio waves strike the aligned protons, they transfer their energy, causing the protons to momentarily shift out of alignment. This resonance, or matching of frequencies, is crucial for the imaging process. By carefully controlling the frequency and duration of the radio waves, the MRI machine can selectively target specific areas of the body, exciting the protons within those regions. This targeted excitation forms the basis for creating detailed images of internal structures. Section 5. From signals to sight, constructing the image. This section delves into the fascinating process of how MRI machines convert raw data into detailed images that help diagnose and treat various medical conditions. As the radio waves are turned off, the excited protons begin to relax back into alignment with the magnetic field. This relaxation process is crucial for generating the signals needed to create an image. During this relaxation process, they release the energy they absorbed from the radio waves in the form of faint radio signals. These signals are incredibly weak and require sensitive equipment to detect them accurately. These signals are detected by specialized antennas called coils located within the MRI machine. The coils are meticulously designed to capture even the faintest signals emitted by the relaxing protons. Sophisticated computer algorithms then process these signals, taking into account their strength, frequency, and the time it takes for the protons to relax. This complex computation is essential for transforming raw data into a coherent image. By analyzing these parameters, the computer can distinguish between different types of tissues based on their unique proton densities and relaxation times. This differentiation is key to identifying various structures within the body. For example, tissues with high water content, such as fat and muscle, appear brighter on an MRI image. This brightness helps radiologists identify and assess these tissues more effectively, while denser tissues, such as bone, appear darker. This contrast between bright and dark areas in the MRI image provides a detailed map of the body's internal structures, aiding in accurate diagnosis and treatment planning. Section 6, a universe of applications from diagnosis to treatment. The applications of MRI in medicine are as diverse as the human body itself. In neurology, MRI is indispensable for diagnosing strokes, brain tumors, multiple sclerosis, and other neurological disorders. Its ability to differentiate between white matter and grey matter in the brain allows physicians to pinpoint areas of damage or abnormality with remarkable precision. In orthopedics, MRI is invaluable for visualizing ligaments, tendons, cartilage, and muscles, making it ideal for diagnosing sports injuries, arthritis, and other musculoskeletal conditions. Its ability to detect subtle changes in bone marrow makes it an important tool for diagnosing and monitoring bone cancer and other bone diseases. Section 7, Safety First, Unraveling the Myths of MRI. One of the most common concerns about MRI is the use of radiation. However, unlike X-rays and CT scans, which utilize ionizing radiation, MRI employs non-ionizing radio waves, which are not harmful to human tissues. And this makes MRI a safe imaging modality for patients of all ages, including pregnant women and children. Another common myth is that MRI machines are claustrophobia-inducing. While it's true that some patients may experience anxiety due to the enclosed space, modern MRI machines are designed with patient comfort in mind. They are often shorter and wider than older models, and some even have open designs to alleviate feelings of claustrophobia. Section 8. MRI versus other imaging techniques, a comparative look. While MRI is a powerful imaging tool, it's not always the best option for every situation. X-rays, for example, are still the preferred method for visualizing bones and detecting fractures due to their speed, cost-effectiveness, and ability to detect even small cracks in bone. CT scans, which use X-rays to create cross-sectional images, are better suited for visualizing dense tissues like bone and for imaging patients with metal implants, which can interfere with MRI scans. However, Connecticut scans expose patients to ionizing radiation, unlike MRI. Section 9. The Future of MRI, a glimpse into tomorrow's healthcare. The field of MRI is constantly evolving, with researchers and engineers developing new techniques and technologies to enhance image resolution, reduce scan times, and expand its applications. Functional MRI, or fMRI, for example, allows us to visualize brain activity in real time, providing insights into how our brains process language, emotions, and memories. As technology continues to advance, we can expect even more groundbreaking applications for MRI in the years to come. From early disease detection to personalized medicine, MRI is poised to play an increasingly vital role in shaping the future of healthcare.